My name is Lori Napier, and I will be presenting my project proposal for NSC 892. The problem for my pilot study is finding an effective method for smoking cessation. This is a significant issue because smoking causes cardiovascular disease, respiratory disease, cancer, and death. 480,000 deaths occur yearly in the United States relating to smoking. $289 billion are spent in healthcare each year because of smoking. For the study, a literature review was completed. Many methods were tested, however, bupropion had the best outcomes for achieving smoking cessation. The study that supports these results was completed by Shang et al. A randomized controlled trial studying the effects of bupropion on smoking cessation was completed in Beijing. There were 248 Chinese smokers. Exclusion criteria for this study included current alcohol or drug dependence, current major psychiatric disorders, history of seizures, pregnant or breastfeeding, or known allergy to bupropion. The results of this study at 12 weeks showed 39.8% of the bupropion group and 8% of the placebo group having smoking cessation. This study concluded stating that bupropion was an effective treatment for smoking cessation in the Chinese population. From this review of literature, I was inspired to do a pilot study to further test these results. The purpose of my study was to determine the effects of bupropion on smoking cessation. However, I will look at all population groups, not just the Chinese population group, and I will extend the study out for a full 6 months. My hypothesis for this study is that bupropion will increase the incidence of smoking cessation. My study will begin with recruitment of participants. The study will be held at the Eastern Kentucky University Richmond campus, so participants will be recruited from the student population. Participants involved in this study must be at least of age 18, have no known allergies to bupropion, they must have been a smoker for greater than 6 months, and have no recent participation within the past 3 months of smoking cessation methods. They must also have no history of seizures. Ethnicity and gender are irrelevant to this study. The way I plan to recruit my participants is to send out mass emails to the student population informing them of the study and requesting volunteers. I hope to have at least 100 participants. Once the volunteers have been recruited, an orientation session will be held by myself, the project leader. The framework and purpose of the study will be discussed, and participants will be given the opportunity to sign the informed consent and participate in the study. The participants will be randomly assigned numbers as personal identifiers. This will be done by allowing participants to draw numbers from a hat. The number they draw will serve as their personal identifier for the study and the surveys. During the initial orientation session, the pre-survey will be completed by participants. The surveys will be created and administered using SurveyMonkey. The pre-test survey will ask participants to share their smoking history and amount of cigarettes smoked daily. Once the survey is complete, random selection of the intervention and control groups will then take place. This will be done by the project leader randomly selecting numbers from a hat. The first 50 numbers selected will be the intervention group, and the second 50 numbers will be the control group. At this point, the 6-month intervention will then begin. Participants in the intervention group will be provided with a supply of bupropion to take over a 6-month period and then be compared to the control group, who will receive no interventional aid to assist with their smoking cessation. After the 6-month intervention, participants will then complete the post-intervention survey. This survey will evaluate their achievement and length of smoking cessation. After the surveys are completed, data analysis will then take place. The survey results will be transferred into an Excel document for analysis. The total number of people who achieve smoking cessation will be calculated. To ensure reliability, data must be analyzed accurately and the study would need to be repeated. Validity of this study would be achieved by having the randomized sample groups and also by using the control group for comparison. Thank you for watching my video. I hope you were able to learn something new.